Good evening. Today I'm going to present about the EDOF lenses in India. These are the extended depth of focus lenses. Yes, so just a brief overview that the idea was the of the extended depth of focus lenses was basically introduced in 1984, and the Nagasawa and Ozuki reported that apparently there can be a +2 diopter of accommodation that we can get in couple of patients. So they formed a correlation between the accommodation and the depth of field, which is inversely proportional to the pupillary diameter. So if smaller the pupillary diameter, the better the depth of focus and the accommodation is. So, commercially, all the lenses were introduced in 2014 June, and they were first introduced in the European market. So this is a picture to depict that what exactly a patient sees when we implant a monofocal or a multifocal lens. So as we can see towards the left, that in a multifocal lens, the distance vision is quite clear, but a patient is very well dependent upon his near vision glasses for the near vision. And also, on the other hand, if we implant a multifocal lens in a patient, so the distance vision and near vision both are readable, but still if we look at the quality of the image, the quality of the image is very different in a multifocal lens. So sometimes the patient does not really get adapted to such a blurry vision and might complain of halos and glare post-operatively as well. So basically, any type of a multifocal lens is broadly divided on two principles, that is refractive and a diffractive principle. In case of a refractive principle, there are multiple rings that a lens has, and these different rings focus on different distances, thereby giving the desired vision at various distances in that patient. This is mainly based on Snell's law, and the rays are bent to a desired focal range. On the other hand, in a diffractive lens, this is mainly based on a constructive and a destructive interference principle, that whenever the light rays overlap each other, they can be focused at multiple distances. And mainly the lenses in the multifocals are being worked on the principle of a hybrid, in which we combine both the refractive and the diffractive principles. The presbyopia correction is the balance of three interrelated factors that we have, which is the quality of image, visual quality, the depth of field, and also the dysphotopsias. Coming to the extended depth of focus intraocular lenses. So these are single elongated focal point that is formed by these lenses, which gives us the plus point of actually having an elongated focus and being able to have a desired image at a particular range, not at a particular only one distance. These, not like multifocal lenses, but have a reduced photic phenomena with the glares and halos. This is mainly because the bright artifacts for the glare and halos are not because of the multifocal rings that exist in these lenses. The disadvantage still, as there's a decreased retinal image quality with the abrasion, and also these lenses do have a neuroadaptation time for any patient that they are implanted into. So there are various IOLs in the market that have the EDOF characteristics. Either they can be a pure EDOF IOLs, which have a spherical abrasion-based EDOF IOL, or it can be IOL that utilizes the pinhole effect, or the hybrid IOLs based on diffractive, refractive, and hybrid refractive diffractive principles. Coming to individual IOLs, so this is the first IOL that I'm going to talk about, which is a minimal ready IOL. This is a one-piece, single-piece EDOF IOL implanted in the posterior capsule, and this is a double aspherical optical design. This particular IOL has three annular zones, which is the inner, middle, and the outer. The inner and the middle have different spherical abrasions of opposite signs, and the outer one works as a monofocal. The overall diameter of the lens is 10.75, and it does have a UV filter. It has a large defocus range, but because of the different zones, it is quite affected by the pupil size. Next is the Technis iHands. This is the one which we are using in our practice.
Dr. Amrita, I'm sorry I'm interrupting.
Yes, please.
For this, I just missed that point for the mini well.
Yes, sir.
what is the central, what is the intermediate, and what is the outermost? Like, what are the three different zones having powers of? Like, which one is for distance and which is like having the hotspot? Is it right in the center or it's in the intermediate, the hotspot?
So they say the hotspot is in the intermediate zone. The
Okay.
because it is pupillary dependent size, so the central zone does work for the near vision distance, but the main zone that works is the intermediate one, because the
So
otherwise
how
the
much is
peripheral.
the ad? How much is the ad in the center and how much is in the intermediate?
So I couldn't get that particular thing for Minivel. I'll just find out and get back to you, sir.
Sure, sure. So because that would be important because then we could
Yes,
know
sir.
that in what pupil sizes we can use it, and whether for a very small pupil we should avoid using it if it has very high central ad. So although these lenses will not really have ads like they're in multifocus, but for example, on the eye hands they say that the ad is in the range of about say 0.75 or something in the center, and BVT has maybe little more. So I was wondering what the Minivel has, and whether how it would be different from our other EDOFs is what I was wondering. But I can see that there are three zones basically.
Yes, sir.
But which one is which? We should know which one is which, right? So maybe later on you can put it on the group and inform us once
Yes,
you
sir.
have found out.
Yes, I think I'll
Great.
find a table to it. I form a table for all the lenses that I'm mentioning. I can get back to you on that.
Yeah, absolutely. That'll be nice. Great. Please carry on. Thanks.
This is the next is the Technis iHands, which is I think we are using in our practice quite avidly, this one. So this is a smooth and continuous progression from periphery to center. This is a single piece hydrophobic acrylic with a 360-degree posterior square edge design. In this particular lens, there is no demarcation line in particular, but it does give a very good distance vision, and with minimum photic effects, it does give an intermediate vision at a range of 66 centimeters. So thereby they mentioned the term as a landing zone. This lens has a larger landing zone than the others. And they do claim that the ad required for a particular age is reduced in these particular lenses. And I think in our practice also, we have found out in some particular patients that the ad was reduced. But I think it was not consistent that all the patients were getting a near ad to be reduced. So we wanted to look into our results also. So I think we'll do that and get back to you on that also, sir. The next lens is the 80 Lara lens. This is a Zeiss lens. It comes in a non-toric and a toric form. This is a continuous diffractive principle and a hydrophobic acrylic IOL. So this is a IOL which does have 25% of water content. So it does have hydrophobic surface properties as well. This works, they claim to be working better at a distance of 90 centimeters and 60 centimeters. The overall size of the lens diameter is around 11 and the optical zone is 6. They have a patented SMP technology which reduces the light scatter in particular, and the range of the IOL available is between -10 to +32 diopters with 0.5 diopters of increment.
So this is not really I mean, it is an extended because basically it's working from 60 to 90 centimeters. It's not giving you any kind of near ability, but the principle seems to be diffractive, right? It's a continuous diffractive, but it's just that they've kept the ad as, less. So how, again, for this also, we would love to know what is the ad in the, like for the diffractive part. It seems to be trifocal because you're saying it works between 60 to 90. So probably it has different ads. If it had only one ad, it would have worked only at 60 or 90. So this means that it may be having different ads in different zones. And maybe if we can just find out like how much is the ad and how much is, in the periphery, the center and the middle, that would be really nice. Right?
Okay, so fine.
So again, we would love to hear whether there is any central zone and whether it is totally diffractive, because even with the diffractive multifocals, for example, with Synergy, you have a different central zone which is not having any, ad or anything, right? So here also we should kind of. Okay.
Yes, sir.
Okay, let's go on.
Next is the Lucidis, which is a Swiss advanced vision lens. So this works on a hybrid IOL with a diffractive principle. It has this one does have a central aspheric element which is surrounded by another outer refractive ring. So this is a single piece foldable with multi-zones, and it also has a 360-degree square edge design with closed loop haptics. And the 1 mm aspheric zone occupies the center, which is surrounded by a 6 mm of refractive ring. The optical diameter again is 6 with the total diameter. Now this one comes in 2. I couldn't find too much of literature on it. I'm still looking through that. They've mentioned that the overall diameter of the lens is 2, whether it can be either in 10.8 mm or it can be also in 20.4 mm. So it is made from hydrophilic acrylic and it also has a water content of 26%. The power range is between +5 to +30 with zero point 0.5 diopters of steps, and they do promise around a +3 diopter of add with the EDOF power.
Oh, so the add is quite high.
Yes,
+3
sir.
is quite a lot. This
Yes,
means
sir.
that it will have a very, what's the size of that
Mil-
central zone?
So the central zone, they
1
say 1
millimeter.
yes, sir, 1 mm with a 6 mm. So this one, they've all the pictures and everything that I found out, it does make a small zone of 1 mm only, which they've say to be for a near and the intermediate, and rest all is for the distance vision.
So if it has a +3 kind of an add right in that central 1 millimeter zone, any
Yes, sir.
patient with a small pupil, we would have to totally avoid this lens because they would be very disabled, right?
Yes.
So because if the pupil was small, then they would be forced to look through that central zone, and then they would not be compatible with their distance vision at all.
But sir, also I wanted to ask in this particular lens, because we are pointing out only +3. So does the intermediate vision also get affected with such a high add that they've mentioned here?
Exactly. So I'm not sure how it is called as intermediate, because
Mhm.
+3 would be actually +3 would be, see, initially when we started off like Restore and all, we used to have +4. And then they found that with
Yes, sir.
+4, people had to hold things very close. So they made it
Very closely.
3.5. And then they also came out with a Restore +3, which was meant to be good for intermediate. Okay. So then, but the 3 was not successful. So then they went back to the using the 3.5, and even on the Technis bifocal, they were using 3.5 only, I think. So that 3 might not be enough to give you that near at 33 centimeters, but probably good enough for say about 40 centimeters, which may be at intermediate approximately, right? So the fact that they're using a +3 and is basically that it will be a little further away from the near point. So it'll somewhere be in between near and intermediate and give you some abilities at both ranges. And
Yes, sir.
also, Amrita, I wanted to know which of these lenses that you've spoken so far are available in toric or not? Because I know
So
that
toric,
Lucidus is
we
available in toric, but what about 80 Lara, iHance,
yes,
and the
sir.
previous?
80 Lara also has a Zeiss 80 Lara toric and a non-toric form. But this one does not. A Technis iHance is a monofocal. In this, we don't have a non-toric version, it is. And the previous one, Minivel, also, I think, is just one lens. They don't have a toric form of that.
Okay, so iHance toric has become available internationally, but not in India, and it should be
Not in
available in
India,
India
sir.
now. Yeah, but currently
Yes,
we
sir.
still don't have it. So please go ahead. Yeah. Anybody else has any comments over here? Okay, maybe you can go ahead.
So there's this another lens, which is a yellow hue chromophobe material, which is called a supraphobe in focus IOL, which is by Appaswamy. So this is a bifocal refractive lens. It does have a EDOF profile. So in this one, they again claim to have a small central zone for near ad, but they have a 3.5 ad with a larger mid peripheral zone for intermediate and the outer one for the distance vision. They mention it to be a peripheral asphericity, and they mention it to be not a real EDOF but a bifocal lens. So the other day, the medical rep from Supraphobe in Focus had come in, but he didn't have too much of information on how the lens has been working and basically what are their results, because he did mention that for the younger patient, if you have put in this lens, you can even get up to N6, and some doctors are even practicing up to N6. But because the details were not too much available for the same, so I can't really comment upon that what exactly is leading this lens to be a better form than the iHands in particular that we are using in our setup. Next is the
This seems
Alcon.
to be very different. This seems to be very different. It's almost like a refractive multifocal with, central for near, and then an intermediate zone, and then an outer zone for distance. So I
Distance.
don't know how whether we can actually call it EDOF. They may be calling it as EDOF design because they're trying to compare it to maybe Vivity or something. But
Yes, sir.
I'm not sure that we'll probably have to study more about it and see
Yes, because
later whether this
actually I asked him to ask the and get some more testimonials from the people who've already been using, so that we could actually get a clearer view, like what is their patient selection and how they are facing it to be better. Because only the outer zone has distance, and again the pupillary dependence might be one of the reasons in this particular lens as well.
right, right. Okay. So I think this, as it is, we are not using it. Vivity will be very interesting because this is appearing to be a very promising lens. So let's see.
So Alcon has come up with Clarion Vivity IOL. So this is available in toric and non-toric forms. This works on a non-diffractive X-wave technology, and this says to be a presbyopia mitigating IOL. So I don't know what exactly they meant by a X-wave technology, but they just mentioned that because of this technology, it does not split light. And almost like in most of the multifocals lenses, the light does not enter inside like totally. Some light is reflected back. So the quality of vision and the contrast is also reduced with such lenses. But they claim that almost all the light energy is utilized. And the monofocal quality of distance vision is 20 by 20 with intermediate better than 20 by 25 and the functional near to be 20 by 32. So they do have a surface transition in two forms. One is a slightly elevated, smoother plateau, which stretches the wavefront according to them, which creates like a continuous extended focal range. And the second thing that they mentioned is a small curvatural change that they've done in a little larger zone than that, which shifts the wavefront to utilize all the available light energy, and the reflected rays are really less. So I think the contrast seems to be a little better in these lenses than the others. Next is the AuroView Vivid. So this is again a continuous range of focus lens, and this has a patented hybrid design lens technology. This is again a combination of a diffractive and a refractive EDOF lens. And these do mention two, three things. That first thing is it has a 3 degrees angulation. So they again try to focus on the PCO formation, leading that because they have a 3 degrees angulation, there's always a chance that the migration of the cells and the vacuoles is little lesser. So the PCO formation is lesser. But I think with the newer design lenses, the PCO formation is also of a little concern, like with respect to the previous lenses, because right now all the greater designs that we have are not having too much of a PCO incidence because of their new designs. This does mimic the accommodative function of the lens, and the optic diameter is 6 mm and the overall is 13. This has a various par available from plus 10 to up to plus 30 with one diopter increment initially, 15 to 25, which is the most common. They have 0.5 of increment and again one diopter. They mentioned to be this inserted as an incision by a wound assisted technique by a 2.2 mm incision. Next, we do have a Raven EMV type of lenses. This is again available in a non-toric and a toric form. This is a non-diffractive IOL which does not utilize any light splitting technology. And this is the only lens that mentions that they have a controlled positive spherical aberration. So usually the other lenses that are mentioned are either using negative aberration or they are using neutrals. Now, this particular thing mentions that because of the positive spherical aberration, they are able to increase the depth of focus into the intermediate range, which complements the natural spherical aberration in the normal human cornea. So that is one thing that makes this stand out from the others. Next is from the Care Group, that is the Magnificent UHD, that is the ultra high depth focus. This is a cast molded hydrophobic MICL with a square edge design. This is again with the UV filter and the blue light blocker. The optic diameter is 6 mm with the length of around overall 13. Pars available are from 0 to up to 40 diopters. And I think this is the last one that I'm sharing. This is the IsoPure. We have used one or two, I think, in our setup also. This gives us a functional intermediate vision in all the pupil sizes and lighting conditions with a polynomial technology with no diffractive rings. This is a particular lens which does mention that this is mostly of a bifocal lens rather than a extended depth of focus or a multifocal lens. So in the end, I feel that EDOF are a good option for the functional near vision, but yet this does not completely eliminate the need for spectacles. But again, whenever we are planning on EDOF lenses because of different designs and maybe the pupillary dependence also, as is in the multifocal lenses, we should still look into the pupillary diameter in the photopic and scotopic conditions, and yet work up the patient in a similar manner as we do for a multifocal. That is how I think we'll be with better results for patients focusing on near vision and the need for near ad that we have. Thank you.
So, Dr. Amrita, I wanted to ask you, can you hear me?
Yes, sir.
Okay, I was asking about IsoPure. I didn't understand what is the optic design for IsoPure, since we are using it and we have it in stock now. And
Yes, sir.
I still wanted to understand better if you have understood what was the IsoPure, because you did mention that it does not have zones. But then how does the optic work? Because what I've understood is so far that there are three possible designs. One is that you can have like refractive zones. For example, you had it in that three zones with that upper lens, or you can have diffractive design as we had with 80 Lara and a few others, or you can have like Vivity or Ihance where there is a gradual increase towards the center,
Graduate.
but
Yes, sir.
there's no sudden zone, like so IsoPure I still don't understand, or how it manages that due to be pupil independent, and what is actually the optical design, because it says no diffractive rings. So is it something like Vivity and Ihance, or is it different? That's what I wanted to understand.
So IsoPure, wherever it's been mentioned, they just mention it to be that there's a different technology named as the IsoPure technology, and they always mention the word to be polynomial technology. So in which they are
Okay.
trying to, I think, I'm not very sure of it, but I think they are trying to put across with their Zernike polynomials. That is how they are mentioning it to be a polynomial design, in which it is coming to be a little aperture dependent also, because they do compare it with IsoPure and a Fizzy IOL thing, na, data available. They just mention
No.
it to
So see, this design, this lens is made by
Fizzy.
Physiol only. Like
Yes,
the
sir.
company's name is
Yes, sir.
Fine Vision, and they used to have a trifocal lens called Physiol. Okay,
Yes, sir.
so that is totally a different technology. That is still available as a Fine Vision trifocal. That's totally different from this. There's no comparison. And so the company Fine Vision makes two kinds of lenses. One is their trifocal design, which is similar to the Physiol lens, and then they make the EDOF lens, which is the IsoPure lens. So the two are not of the same technology actually. So we should maybe, I'll try
I
to find out
think we'll
more on
just
this and let
read,
you know. Huh?
I'll just read more about it, sir. I think then I
Ha,
might have
ha, ha.
misunderstood it.
I'll
Maybe
tell
I
them
can get.
to send you more data. And so I think you
Yes,
need
sir.
to update us on a few things, that where all are torics
Yes, sir.
available. I mean, we already know about one or two of them, and about a couple of other things about, because see, EDOF is becoming very popular now, and EDOF is actually eating into the bifocal and trifocal segment, because the risk of halos is much less, and also the chances of with retinal pathology and other things, the tolerance is much better of these lenses. So you'll not end up burning your fingers, except that obviously you're not giving that good near ability as you can with maybe Synergy or trifocal lenses. So off late, my experience with Synergy has been excellent, and we've also of course used the 80 laser trifocal, which also works well, and so does Panoptix. But then with those, again, the two things that patients may see, compare halos and glare and everything, they may see that, and they also get the benefit of better near vision than with any of these lenses. So I think prudently we can use this, but the patient expectations have to be right. If we give them that expectation that you'll be able to read at near range, then we'll go totally wrong. And also we should be very careful when using these lenses. Some of these may be on the refractive multifocal design, which were used to be popular 15-20 years back, and if they were abandoned because they were very pupil dependent. So we should also be very careful. Some of these lenses that you've spoken about are looking like very much similar to the refractive design which used to come in the long back. So we probably have to be very careful, otherwise we'll have unhappy patients. So we should be prudent when using any new lens, and we should know the optical principle very well before touching a new lens and trying to put it in a patient. So anyway, but you've done a very good job of presenting this. But we would love to hear more information. Whatever you gather over the next couple of days, please keep us posted on the group. And if anybody else has any doubts or questions, maybe Dr. Ruchika, Dr. Shweta, somebody would like to ask anything or comment, it would be nice.
Good
So
evening,
also I
Or
sir.
wanted
anybody else,
to ask,
Vaibhav is there, I think.
sir, also I wanted to
Yeah.
ask, in case of eye hands also, do we need to do a pupil diameter and everything for
No, not really. Because see, first thing is that the ad is very small. In fact, most patients whom we put in eye hands, they end up needing reading glasses of plus 1.75 or so, 1.5 to 1.75. So which tells you that the ad on them is just about 0.5 to 0.75 at most. And they are quite tolerant. I mean, I have not had to look at the pupil size at all for the eye hands at least. Eye hands has very good tolerance and it's just a Technis lens with a little bit of ad in the center. And there's no zone. So it's just got a continuous increase towards the center. Not really pupil dependent.
okay, sir.
Good evening, sir.
So I think.
So just
Hi, Dr.
one
Shweta, good
question.
evening. Yeah.
Hello.
Huh?
Yes, sir. So basically, if anybody asks, I mean, these are like mostly for intermediate and your vision, right? Or these are only for intermediate
Mostly for
vision?
intermediate. They are not really for near vision because near vision will be good only with most of our trifocals or bifocals. So most of EDOF extended
Okay.
depth means that mostly they will work for intermediate. One or two of them, as you saw,
Okay.
they were promising some near
So,
ability as well.
okay,
But none of
somebody
them is
for
going to give
like
very good
mostly
near
for
ability.
laptop and desktop work,
Yes,
right?
absolutely. And that's frankly the need of most patients nowadays. So that's why they are becoming popular.
Right. Okay. Okay, sir. Thank you, sir.
Great, welcome. And I think we did not include one lens, which was also kind of promised as an EDOF lens. And I forgot to tell Dr. Amrita to include it. That's the Symphony lens. Because Symphony used to be also used, although it was having rings and everything, but it was also used as an EDOF. It fell out of use now. We don't use it as much, but it was very popular at one time. And we will see a lot of patients who are operated with the Symphony, especially in the MH, because it was available in the MH and in the armed forces for some reason. And it was popular in the RNR and also in our MH also, some patients received a Symphony lens. So anyway, we should know about it and we may not be using it anymore, but it's still available. So I think we've had a very good class. Dr. Ruchika, any thoughts? Otherwise, I think we can, Tulsi, you have anything to say or maybe?
Sir, there is another lens under EDOF, but it's a combination of both diffractive and EDOF, which is called Triumph lens from Fine Vision. So
Okay.
I don't know much details about it, but it comes under both EDOF and trifocal, and it works under diffractive technology.
So if you can find out for us how it works, it'll be really nice because then you can post it on the group about what lens actually works. It'll be nice to know. Right.
And sir, I have one doubt. How do you target? Do we target emmetropia and EDOF lens or trifocal lens?
So for the first eye, I would target
hyperopia or
emmetropia. I would always target emmetropia for the first eye, and then depending on that and how the patient finds it, I might, if you might have noticed when I do the biometries, then for the second eye, I sometimes try to make them 0.25 to 0.5 myopic. Even with eye hands, I tend to do that. First eye, I will usually tend to either the dominant eye or the first eye, I will try to keep it plano. And depending on what we get from the first eye, then I sometimes try to change it to the other lens, I mean, for the second eye, I may aim for a micro monovision. So that's how I usually plan it out. Okay. So if that's all, then we can call it a day. But thank you so much for a nice class. And I think we have one more class lined up for tomorrow, Dr. Tulsi.
Yes, sir. Yes, sir. It's
Okay.
on advanced intercam features.
Perfect. It'll be very useful, I think, to everybody. And we'll be looking forward to that. Huh? Thank you. And very good night to everybody. Thanks for joining.
Thank you, sir.
Good night, sir. Thank you.